I heard a story from one of my grandmothers. What she said was, when they came to sign treaty, they had that medicine chest. And the grandmas came and they brought their medicine and they put it inside that box. And so when they signed treaty, they acknowledged Western medicine and also Indigenous medicine or First Nations medicine. But they brought the medicine that was going to help all parts of your body. That's how it began, and that's how it should be.
We've seen that in the news of some of the people that died under care, that were discriminated.
Sometimes we just can't avoid it. I know racism. I sense racism. I smell it and I see it. And I try and figure out what's the best way through this system, or I'd be fighting every single day.
If we get upset, we'll get more sick. Yeah, so we have to do the best that we can for that moment.
Our voice has been taken, so we don't speak for ourselves. We don't talk for our loved ones because we're afraid the system has hammered us down so much.
As elders, I think we have to teach. You're going to go into a strange place. They're going to ask you questions that might be embarrassing. So I do this all in my language. But what would be better still is an advocate that works in the hospital to advocate for what they're wanting or translate what they're wanting.
The government has a responsibility to change it. And the only way I can see it change is that, we need to train, these professionals in terms of how they treat our people.
Well, a system evolves. Like any system in this world, it evolves. When they signed treaty, there was no clear definition on how the application of services towards health was going to be administered. And over time it grew. And when it grew, every First Nation was entitled to 100% premium care. But then it changed, and it became a co-management arrangement where now there's a whole bunch of questions. Who's going to pay for what? What kind of medicine are we entitled? Why is it that some of the services we got prior are not there anymore? So it's good for people to go back to their communities or go back to the leadership or go back to their political offices and ask those questions.
We're at a place where we can start to help each other heal. And what we need to do is to help each other to have a voice. And once we get to that place where we can speak of pain and hurt, then we can help others speak of it. We're not a people who think we have the solution for everything, but together we can work for those solutions.